Hello, this is Nursing School. My name's is Patrick. Today, we are going to learn the oxygen therapy. Remember to subscribe to Nursing School. Let's start our class. Oxygen therapy, a vital treatment. Oxygen therapy is a medical treatment that involves providing supplemental oxygen to individuals who are unable to get enough oxygen from the air on their own. How does oxygen therapy work? When we breathe, our lungs absorb oxygen from the air, which is then transported throughout our body to cells and tissues. In individuals with certain medical conditions, the lungs may not be able to efficiently absorb enough oxygen, leading to low blood oxygen levels. Oxygen therapy helps to replenish this oxygen deficiency by delivering additional oxygen directly to the lungs. Common conditions treated with oxygen therapy. Chronic obstructive pulmonary disease, COPD, a condition characterized by chronic inflammation and narrowing of the airways. Pneumonia, an infection of the lungs. Pulmonary fibrosis, a condition where lung tissue becomes scarred and stiff. Heart failure, a condition where the heart is unable to pump enough blood to meet the body's needs. Sleep apnea, a disorder where breathing repeatedly stops and starts during sleep. Types of oxygen delivery systems. Nasal cannula, a simple device that fits over the nose and delivers oxygen through small tubes. Face mask, a larger mask that covers both the nose and mouth, providing a higher concentration of oxygen. Oxygen concentrator, a machine that extracts oxygen from the air and delivers it to the patient. Oxygen tanks, portable tanks that store compressed oxygen and can be used for home or travel. Benefits of oxygen therapy. Improved breathing. Oxygen therapy can help alleviate shortness of breath and make it easier to perform daily activities. Increased energy levels. Adequate oxygen levels can lead to increased energy and reduced fatigue. Enhanced quality of life. Oxygen therapy can improve overall well-being and quality of life for individuals with respiratory conditions. It's important to note that oxygen therapy is a medical treatment and should only be used under the supervision of a healthcare professional. Types of masks used for oxygen therapy. There are several types of masks used for oxygen therapy, each designed to deliver oxygen in different ways and at varying concentrations. Here are some common types. Nasal cannula. Description: a simple device that fits over the nose and delivers oxygen through small tubes. Benefits: comfortable, easy to use, and allows for talking and eating. Best for mild oxygen needs or patients who need to maintain alertness. Nasal cannula simple face mask. Description: a larger mask that covers both the nose and mouth. Benefits: provides a higher concentration of oxygen than a nasal cannula. Best for moderate oxygen needs. Simple face mask partial rebreathing mask. Description: a mask with a one-way valve that allows exhaled air to be partially rebreathed, increasing the concentration of oxygen. Benefits: provides a higher concentration of oxygen than a simple face mask. Best for moderate to severe oxygen needs. Partial rebreathing mask non-rebreathing mask. Description: a mask with a one-way valve that prevents exhaled air from being rebreathed, providing the highest concentration of oxygen. Benefits: used in emergency situations or for patients with severe respiratory distress. Best for severe oxygen needs. Non-rebreathing mask Venturi mask. Description: a mask with a fixed oxygen concentration that is adjusted by changing the size of the Venturi tube. Benefits: provides a precise concentration of oxygen. Best for patients who require a specific oxygen concentration for medical reasons. Venturi mask. The choice of mask will depend on the patient's individual needs, the severity of their respiratory condition, and the desired oxygen concentration. Low-flow delivery devices nasal cannula 1 to 6 liters per minute, 24% to 44% safe and simple, easily tolerated, effective for low concentrations, does not impede eating or talking, inexpensive, disposable, unable to use with nasal obstruction, drying to mucous membranes, can dislodge easily, may cause skin irritation or breakdown around ears. Patient's breathing pattern, mouth or nasal, affects exact fraction of inspired oxygen. Simple face mask 6 to 12 liters per minute, 35% to 50%, is useful for short periods such as patient transportation. Contraindicated for patients who retain CO2, may induce feelings of claustrophobia. Therapy interrupted with eating and drinking, increased risk of aspiration. Partial and non-rebreather masks 10 to 15 liters per minute, 60% to 90% useful for short periods, delivers increased fraction of inspired oxygen, easily humidifies O2. Does not dry mucous membranes, hot and confining, may irritate skin, tight seal necessary, interferes with eating and talking, bag may twist or kink, should not totally deflate. Oxygen conserving cannula, Oximizer, 8 liters per minute, up to 30% to 50% indicated for long-term O2 use in the home, allows increased O2 concentration and lower flow cannula, cannot be cleaned, more expensive than standard cannula. High flow delivery. Devices Venturi mask 24% to 50%, provides specific amount of oxygen with humidity added, administers low, constant O2 mask and added humidity may irritate skin. Therapy interrupted with eating and drinking, specific flow rate must be followed. Thank you for following Nursing School. My name's Patrick. See you soon.